Hi there, I'm Amy Griffiths and I'm one of the journalists in Manx Radio's newsroom, and you're listening to Newscast.
Claire Christian, MHK.
What exactly is the Department of Health and Social Care's role within these negotiations?
First of all, I think it's a really good question. So I think since coming into the role, I have, alongside with the department, met with the BMA and the local negotiating committee twice. That was not in the essence of trying to sit and be part of any negotiations, but what that was a real listening task for me. I really wanted to understand where they were coming from, and not just in terms of with their organisation, but also what their needs are and what their staff's needs are. And I think that those meetings have been really invaluable, and it's building, for me, because I'm new, it's building that relationship up with them, and hopefully to build that support for going forward in future. We're not part of the actual official negotiations. They are run by Manx Care, and they're facilitated by MERS, Manx Industrial Relations. So they're the ones that work with the BMA over these negotiations, and whereas the DHSC doesn't actually sit part, and the Minister doesn't actually sit part at the table at those negotiations.
Because that's something that's actually been mentioned this morning by a backbencher, that they felt like ministers shouldn't be part of the negotiations because they're then not in a place then to be able to reassure the public. And is that something that you agree with?
So I think that the Minister definitely, in terms of my role, I'm obviously very cognizant of the situation, and it's really important for us to be updated about the situation, so that we can, as you've said, and as that backbencher's completely right, we need to reassure the public. But Manx Care are also, they have a responsibility to update the public as well.
Does the final decision on whether Manx Care would be allowed the extra money for pay rises ultimately lie with yourself and the department, or where does that decision lie?
So Manx Care obviously have a budget that's allocated to them from Treasury, from the DHSC. So any pay rise needs to come from within that budget.
So there would be no scope to ask for any more to be added to that budget, for example?
Obviously, that goes through a process that would be put forward to Treasury. But the situation is that it's been set for 24-25. The budget has been set at 357. That was in the Pink Book, so that's already there.
Yesterday, when we last spoke, you said that you didn't want to publicly comment on the industrial action at that point while negotiations were ongoing. You have now made yourself available for interviews. So what is the position now?
So, yes, yesterday, you're absolutely right. The situation was we just wanted to hold just for 24 hours, obviously until the BMA came back, and they have now come back with a counter-offer. So Manx Care are now working through that. They're working through the detail on that. And the reason why I kind of hoped I would have more news today, but I've gone ahead with this interview anyway, but it is going to take a couple more days, possibly into next week, before we know the final sort of position.
In October, Manx Care announced a number of cuts to its services in a bid to reduce its overspend. The doctors want over 12% increase. Would more health and social care services be at risk if the pay demands aren't met?
It's a good question.
If the pay demands are met, yeah. I should say, sorry.
Yeah, it's a good question. I think you have to strike a balance, don't you, about being paying doctors what's fair. So Manx Care made a revised offer on the 19th of December, and that offer recognised the issue of comparability of pay on the island with their counterparts in England. And I think that's really important. And that clearly reflected a willingness to make the pay scales for resident doctors, which are probably more widely known by the public as junior doctors, more comparable to England, where it's clear the Isle of Man has fallen behind that. So within your question, back to your question, would services be cut? In other words, in order to pay, it's about finding that balance. We're certainly not looking at cutting services. We're looking at how we can make efficiencies to pay that. Now, one of the discussions that Manx Care has had with the BMA is about job planning, and that is about certainly making the better informed job planning so that they can make the money to pay the awards, if that makes sense. It's quite complicated, so that's the way around.
When Manx Care announced its initial round of cuts in October, you said that Manx Care was holding a gun to the head of government, which was before you became minister. And do you stand by those comments, and has your perspective changed since then?
So at the time, and it's always to kind of put the perspective, obviously at the time I did say that I hadn't actually seen the list of cuts that they were proposing to make. And obviously the Council of Ministers have said at the time and now have said that those cuts would not happen. It certainly, it would have, we have to make these cuts or you have to give us more money. It is that kind of impression. It's either or. So certainly being now as Minister of DHSE, it is about that kind of working with Manx Care, understanding what pressures they're under and vice versa, understanding the pressures that the government is under in terms of we don't have, we've got to spend taxpayers' money better and correctly, so that it's understanding those two pressures and aligning.
Going back to negotiations with the BMA, you say that DHSC hasn't necessarily been involved with the negotiations, but do you know what kind of options have been considered? I know there have been people who've been suggesting a sliding scale, for example, of increases, meaning that the doctors on the lowest pay are the ones that get the highest increase, for example.
Yeah, so it is quite detailed because there are many pay scales, but so essentially the new pay offer does represent a significant pay uplift in pay for most doctors, and that would be sort of in the junior roles, which would equate to a 20 to 29% uplift. But right now, what we're doing, Manx Care have informed me that they are now using the figures that has been presented to them in the counter proposal to do some calculations and financial modelling on the more senior roles, and particularly the consultants. But it's a particularly complex area to draw like-for-like comparisons, given the differences across the sort of systems.
What exactly are you and Manx Care doing to try and avoid this strike action happening?
So I absolutely am encouraging both sides to come to an agreement with these negotiations, and I absolutely can confirm that both sides are working exceptionally hard to do that, and I wholeheartedly support and encourage these negotiations to continue over the coming days to try and avoid strike action. That's really the message, and really, I know that Manx Care and obviously with obviously in speaking to the BMA and ourselves, no stone will be left unturned to try and reach that agreement.
And so aside from the issue of pay, does the fact that doctors are actually willing to strike for the first time in the island's history show a much deeper rooted problem for the government? And doctors are clearly unhappy here. The pay isn't comparable with other jurisdictions, and we already know there are difficulties with recruitment and retention. So the island can't do without these professionals, so surely something has to give somewhere.
Absolutely, and that's what's part of the negotiations that I spoke about. Really recognising the work that these doctors do. I think that if the strike does go ahead next week, this, as you've said, it would be the first time the Isle of Man has been into strike, which clearly no side wants. In England, we do know that the doctors had a long-running dispute with the government, which included strike action and other action short of strike, but that was resolved last summer, and that obviously had an impact on the disparity. Since I've been in role, which was towards the end of November, I certainly was very encouraging to get that parity with the UK, and certainly conveyed that message to Manx Care.
Do you think the issue of healthcare funding has reached a crisis point?
I think that, over the last 3 months, the healthcare funding has had, a real sort of laser focus. We've, implemented support, that's both financial and operational support within Manx Care to help them assist to balance back to budget. So I know that it's not at crisis point, because if it was at crisis point, then we wouldn't be continuing, and we are continuing, and we will, hopefully achieve what we're setting out to do. So, but the situation is, unfortunately, demand has increased. Our ageing population, these are situations that are not new to the public, and they do understand that. But we do need to have some honest conversations that, about healthcare. The Treasury Minister has spoken before about there being a healthcare tax to help contribute towards healthcare in the future, and that's certainly something that needs to be explored for the future.
And you mentioned that tax. That was something that was implemented in last year's budget. I remember having a conversation with the Treasury Minister at that point and asking him whether he could guarantee that within a year's time, because of that tax increase, things in healthcare would be better directly as a result of it. And can you really say hand on heart that that's come to pass?
So yes, you're right. The extra 2% or 10% that was put on the tax rate was absolutely ring-fenced for healthcare. And if we're looking at last year, I've certainly gone. I go around. I've obviously been around Nobles Hospital. Absolutely, healthcare is being delivered safely, efficiently. But are there things that we can do better? Absolutely, yes. So, as I say, my role and my focus now is helping Manx Care to be able to do that, and giving them the support from the department to be able to do it.
I don't think anybody would dispute government's goal of trying to look at how it's spending its money and see where efficiencies can be made. But also, I don't think you'd find anybody who says that healthcare is where we should be focusing a lot of our cost-saving measures. And do you think government's right in its prioritisation of the healthcare system, and Manx Care's historically always maintained that they are underfunded rather than over budget, and are you starting to think that there may be some truth with that? Is government focusing its priorities in the right area?
So I think that's it's an excellent question. It's a little bit more, nuanced in that respect. Since I've been in position, looking at the way the structure of healthcare is delivered on the island. The long-term strategy is to put more funding into primary and community care, because if you can do that, then you're spending less in the hospital later on in tertiary, etc. And that is that shift that we fundamentally have to take. And that's not going to be easy, because trying to pay for both of those at the same time is difficult. But my focus as the new minister is to make that shift in this administration and start that pathway, because if we don't start that now, we're going to be facing a far worse situation 5-10 years down the line. So when I talk about, the primary care, I'm talking about everything that really touches people in a far more wider sense, getting a GP appointment, getting a dentist appointment. We've really got to reinvest, looking at that, how we can make that better, and getting people the care in the community first, and getting it right first time. And that could be mental health, that could be social care, it could be all different aspects. I have a really great example which I love giving to anybody that wants to talk to me about this subject. I have somebody that couldn't get a doctor's appointment for a couple of weeks. weeks, and then they eventually speak to meds, and then they eventually end up in A&E. And the cost of that, is fundamentally being almost paid for 3 times. So if we can get it right in the first instance and really look at that, then the cost benefits down the line for Manx Care providing these services will be better.
But I suppose the question there is where do you start? I mean, you look at, if you mentioned dentists there, was it nearly 6,000 people currently waiting for an NHS dentist? I know my son's 2, he's been on the waiting list since the day he was born and still is nowhere closer to getting a dentist. My husband and I have been on it for 4 years, still nowhere near closer to getting an NHS dentist. And so where do you even actually begin to start improving those primary services that are the things that people really care about? That's what matters to people.
It is absolutely what matters to people, and it matters to me. So I've actually come in at a really good time, because whilst they're looking, this is the moment where we're doing the mandate, we're doing the operational plan, and we're doing the finance, the budgeting. And all 3, this will be the first time this is being done all together. Normally the mandate comes and then the operating and so on. So I've come into a really good time where basically we're planning for 2020 for 25-26 going forward, and that's where we can shift the funding slightly to, and it's not astronomical amounts, but it's shifting certain amounts of funding into primary care. And then I will be, over the next coming months, be talking about that and what differences I hope that the public will start to be able to see, and what timeline, so I can manage the public's expectations. It's not something I can do overnight. I wish I could, but as I say, I've been in the role 7 weeks now. So, that is absolutely my priority, and I hope to get the support of the public in that. That's the message, and that's what we want to be doing.
Just finally then, going back to the strike action, is there a message that you want to give to the Manx public of reassurance to them about what lies ahead?
Yes, so if the strike does go ahead, Manx Care will be issuing, once they've had more information from the BMA about what the strike action will look like. There'll be more information about that coming out in the next couple of days. But what I would say, I've seen some questions about, does that affect my GP service? So it doesn't affect GP services, with the exception of one GP, which is in Ballasalla, because they are Manx Care employees. But as I say, we don't know who will strike. It's like any strike. We don't know who and how it will look like on the day. But I'm in conversations that I've had with the BMA and also Manx Care. Safety comes first. Absolutely, they are all cognizant of that. So as the Manx Care have announced, and also the BMA announced, they'll be running out what's called Christmas services for those 2 days.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.